You've done everything right. You've navigated life's challenges to reach your 70s, staying active and engaged. You go to your annual physical. You trust your doctor. You take the tests they tell you to, believing you are doing everything in your power to stay safe, to protect your future. But what if the very system designed to protect you is now the source of your greatest risk? What if I told you that some of the most common just-in-case tests given to seniors don't just find problems, they create them? New research from the most respected medical journals reveals that for millions of seniors, routine screening triggers a devastating domino effect. Unnecessary biopsies, powerful antibiotics that wreck your system, and life-altering surgeries for conditions that would never have harmed you. It's a cascade that can turn a healthy, active person into a frail patient, all in the name of prevention. Today, we are uncovering the 5 routine health checkups that can backfire after 70, and the truth about the #1 test on our list. It has a false alarm rate so high, it has been called one of modern medicine's greatest and most harmful controversies. Before we begin, let us know in the comments below, where are you watching from? And do you ever feel that modern medicine focuses too much on tests and not enough on the patient? We are reading and replying to every single comment, and we truly want to hear your story. And if this video helps you, please take a moment to like and subscribe. It tells the algorithm to share this vital information with more seniors just like you. Now, let's get started. Checkup number 5. The routine pap smear and pelvic exam. For decades, women have been taught that the annual pap smear is a non-negotiable part of healthcare. It's been a true miracle, responsible for a dramatic drop in cervical cancer rates. So it's only natural to think this protection should continue forever. But here is the hidden truth. For most women, this test becomes unnecessary and even risky after age 65. Both the U.S. Preventive Services Task Force, USPSTF, and the American College of Obstetricians and Gynecologists recommend stopping routine cervical cancer screening for women over 65 if they have had adequate prior screening, meaning a history of normal tests. Why? Because cervical cancer is incredibly rare in this age group, especially for those who've had normal tests in the past. The harms of the test, however, become more common. As women age, normal benign changes in the cervix called atrophy can look abnormal on a pap test. This false alarm triggers a terrifying sequence. Let me tell you about Eleanor, a 78-year-old grandmother. She had never had an abnormal pap test in her life, but her new doctor insisted on one just to be safe. The result came back inconclusive. She was sent for a colposcopy, a painful and invasive biopsy of her cervix. She spent 3 weeks terrified, convinced she had cancer, waiting for the results. The result? Benign atrophy. It was nothing. But the stress of the procedure and the anxiety of the cancer scare were very real, causing her blood pressure to spike for months. For women over 65 with a clean history, the better option is to listen to your body. Any new postmenopausal bleeding or spotting should always be investigated immediately. But the routine just because scraping? The science says it's time to stop. Checkup number 4, the just-in-case annual EKG. The electrocardiogram, or EKG, is a fast, painless test. A few stickers on your chest, 30 seconds of quiet, and you get a snapshot of your heart's electrical rhythm. It seems like a perfectly harmless way to check on your most important organ. But here's the problem. When used on people who have 0 symptoms of heart disease, no chest pain, no dizziness, no shortness of breath, a routine EKG is a classic example of a test in search of a disease. As we get older, our heart's electrical signature changes. It's a normal part of aging. In fact, studies show that a large percentage of seniors over 70 have EKGs full of non-specific abnormalities, or minor ST segment changes. In 99% of asymptomatic cases, these changes are meaningless. They do not predict a future heart attack, but a doctor sees that abnormal printout and they can't ignore it. It's a medical legal landmine. This one harmless test triggers an immediate referral to a cardiologist. That leads to an expensive echocardiogram. It leads to a cardiac stress test, which has its own high false positive rate. And that can lead to an invasive angiogram, where dyes can harm your kidneys and procedures can carry risks of stroke or bleeding. A 2018 study in JAMA Internal Medicine was clear. Screening asymptomatic, low-risk adults with a resting EKG did not reduce mortality and did not prevent heart attacks. A much better approach? Check your blood pressure, get a cholesterol panel, and have an honest talk with your doctor about your diet, your exercise, and whether you smoke. Those things actually prevent heart disease. A random electrical snapshot often just causes panic. Checkup number 3, the routine urinalysis, the P-cup. This one will surprise you. It's the humble urine test. You're asked to give a sample at almost every doctor's visit, every hospital admission, or before any procedure. It seems so simple, but for seniors, this test is the gateway to one of the most dangerous overprescribed medications, antibiotics. Here's the scientific truth. As many as 50% of older women and 20% of older men have something called asymptomatic bacteriuria. In simple terms, it means your bladder is harmlessly colonized by bacteria. You have no symptoms, no pain, no burning, no fever, no confusion. You do not have an infection. But the dipstick test finds those bacteria, and the doctor, fearing a hidden UTI, immediately prescribes a powerful, broad-spectrum antibiotic. This is where the harm begins. That antibiotic carpet bombs your entire system. It kills all the good, protective bacteria in your gut, leaving you wide open for a truly dangerous infection, C. diff, or Clostridioides difficile. C. diff causes severe, debilitating diarrhea, dehydration, and inflammation of the colon. For seniors, it can be fatal. Take Robert, 81. He was admitted for a simple elective knee replacement. He felt great, but a routine pre-op urine test found bacteria. They delayed his surgery and put him on a 10-day course of antibiotics just to clear it up. He never got the infection because he never had one. But 2 weeks later, he was rushed back to the hospital with a raging C. diff infection. He spent 12 days in isolation, lost 15 pounds, and the infection ultimately destroyed his health for months. Unless you have clear, undeniable symptoms of a urinary tract infection, medical guidelines now strongly recommend against testing for or treating asymptomatic bacteria. Your vision is getting cloudy. Your doctor says you have cataracts, and a simple 15-minute outpatient surgery will let you see the world clearly again. But first, the surgeon says you need to get medical clearance. This often means a full battery of tests, a chest x-ray, an EKG, a panel of blood work. It sounds responsible. The surgeon just wants to be safe, right? The truth is, for low-risk procedures like cataract surgery or a minor skin biopsy, this blanket testing is almost pure defensive medicine. And the tests can be more dangerous than the surgery. Here's the cascade. The chest x-ray finds a tiny, blurry nodule. It's almost certainly an old healed scar from an infection you had 50 years ago, but it could be cancer. Suddenly, your simple cataract surgery is canceled. You are sent to a lung specialist. You get a high-radiation CT scan, then a needle biopsy, all for this incidentaloma, an incidental finding that never would have hurt you. Meanwhile, for weeks or months, your vision gets worse. Your risk of a fall increases. Your quality of life plummets. The American Academy of Ophthalmology and many other specialty groups now explicitly state that for low-risk procedures, this battery of testing is unnecessary and can lead to harm and delays. A simple physical exam and a discussion of your history is all that's needed. Don't let a just-in-case test for a minor surgery turn into a major medical ordeal. Checkup number 1, the PSA, prostate-specific antigen test. We've arrived at number 1, the checkup you've been warned about. It's a simple blood test for men, the PSA. For decades, it's been the gold standard for catching prostate cancer early. And what could be more important than that? Here's the terrifying truth. For men over 70, the PSA test is not a lifesaver. It is a life ruiner. The U.S. Preventive Services Task Force gives screening for men 70 and older a C grade, stating the benefit is small to none. Why? Because of a 3-part cascade of harm. Part 1, the false alarm. The PSA is not a cancer test. It's a test for inflammation. Your PSA can be high because you have a benign enlarged prostate, a minor infection, or even because you rode a bicycle recently. It has a massive false positive rate. Part 2, the harmful biopsy. A high PSA triggers a biopsy. This is not a simple procedure. A doctor sticks a needle through the wall of the rectum and into the prostate 12 to 16 times. The risk of serious infection, sepsis, and bleeding is significant. Part 3, the devastating overtreatment. The biopsy finds cancer. But here's the secret. Most prostate cancers found by PSA are indolent. They are slow growing. They are, as one doctor famously put it, cancers you will die with, not from. But once a man hears the C word, it's almost impossible to do nothing. He is terrified, so he undergoes the cure, a radical surgery or radiation. Let me tell you about David, 72. He was an avid golfer. His routine PSA was slightly high. A biopsy found a tiny, low-grade cancer. He had the surgery. Today, David is cancer-free, but the surgery left him with permanent, total incontinence and erectile dysfunction. He can no longer golf. He can't travel. His quality of life is destroyed. He was cured of a disease that almost certainly would never have killed him, but the cure cost him everything that mattered. For men over 70, this is not a routine test. It is a life-altering choice. You are far more likely to be harmed by the treatment than by the disease. So there you have it. 5 routine checkups that can start a cascade of fear, complications, and treatments you never needed. The truth is, after 70, the goal of medicine must change. It's no longer about simply extending life. It's about quality of life. It's about having the energy to play with your grandkids, not sitting in a waiting room. It's about enjoying your hobbies, not recovering from a biopsy. Modern medicine is a miracle, but sometimes its greatest power is knowing when to do less. Your greatest tool is your voice. You have the right to ask, why are we doing this test? What happens if we find something? And the most important question of all, what happens if we do nothing? Real prevention after 70 isn't found in a scanner or a blood test. It's found in resilience, in strength training, in a walk with a friend, in a home-cooked meal, in a good night's sleep. Don't let the fear of disease steal the joy of your life. What did you think? Did any of these 5 checkups surprise you? Have you or a loved one ever been pushed into a test you later regretted? Share your story in the comments below. Your experience is valuable, and it could help someone else in this community make a more confident decision. Thank you for watching.